Uasin Gishu hoye! Hebu punga mkono nijue kama tuko hai. Asante sana. Leo nimetumwa na Rais wa Jamhuri ya Kenya, Mheshimiwa William Samoei Ruto, tukiwa na wenzangu, ili nimwakilishe kwa siku hii ya muhimu sana katika taifa letu na ulimwengu kwa jumla. Kwa hivyo kitendo changu cha kwanza kitakuwa kusoma hotuba yake. Nikishamaliza kusoma hotuba yake, basi nitaongeza yangu. Sio ni sawa sawa? Asante sana. So let me start by conveying the message from His Excellency the President on this very important day. Good afternoon to you all. Every year, on the 24th of March, we join the rest of the world to commemorate World Tuberculosis Day, to raise awareness about the devastating health and socioeconomic consequences of TB, and step up our efforts to end the global TB epidemic. Tuberculosis is a serious and potentially fatal infectious disease that affects many people around the world, including Kenya. Globally, as you have heard from previous speakers, an estimated 10.6 million people fell ill with TB in 2021, an increase of 4.5% from 10.1 million in 2020, reversing years of a slow decline. The COVID-19 pandemic reversed progress made in the years up to 2019 and set global TB targets off track. The reductions in the reported number of people diagnosed with tuberculosis in 2020 and 2021 due to the pandemic suggest that the number of people with undiagnosed and untreated TB has grown. This has resulted in an increased number of TB deaths, community transmission of infection, and numbers of people developing tuberculosis. Ladies and gentlemen, the good news remains that TB is treatable and curable, and our champions proved it to us. With timely diagnosis and treatment, we can overcome it. Unfortunately, access to diagnosis and treatment is often limited, leaving many people without the care they need. In Kenya, recent estimates show that 133,000 people have developed TB, among them 16,000 children. This is a huge burden on the health system and a major barrier to economic development. In 2022, the Ministry of Health reported 90,841 tuberculosis cases compared to 77,854 cases in 2021. That means there was an increase of over 10,000 cases from 2021 to 2022. TB remains a leading cause of death worldwide and is the fourth leading cause of death among infectious diseases in Kenya. The burden for TB and HIV and drug-resistant TB remains high. We have made progress towards reducing the tuberculosis burden in Kenya through robust multi-sectoral partnerships, increased domestic resource allocation for TB programming, rapid adaptation of innovations, and global WHO guidelines recommendations, expansion of TB diagnostic capacities, and improved integration of TB services into other programs, ensuring access to quality tuberculosis services for all. Kenya, in collaboration with our partners, and they have been well represented here, has invested in critical components of TB care and management by doing the following: expanding and strengthening access to the tuberculosis diagnostic network and services through the introduction of high-end diagnostic equipment, introducing digital adherence technology in support of drug adherence, and providing preventative treatment for people at high risk of contracting TB. 3, development and rollout and sustenance of awareness campaigns to create demand for TB services and treatment to completion. Equally, by strengthening the public and private mix. Also by offering free diagnosis, like today, and treatment to all TB clients, providing financial and technical support to healthcare providers, establishing a robust national TB surveillance system, strengthening infection control measures in health facilities, providing social protection to all drug-resistant TB patients by enrolling them for NHIF and providing them with monthly stipends. The theme for this year's World TB Day is an urgent call to action. Yes, we can end TB in Kenya. It is a call for unity of purpose, thought, and action. On behalf of the government of Kenya, let us all say, yes, we can end TB in Kenya. Hebu nisikie. Yes, we can end TB in Kenya. The implementation of the in-country multi-sectoral accountability framework for TB responses testifies to our commitment to this cause, in line with the 2018 United Nations High-Level Meeting on TB. Through the framework, we bring all stakeholders together to come up with innovative strategies that will help us meet our 2030 targets. We are grateful for the role community health workers, affected communities, civil societies, and donors play. The government will continue to strengthen our collaboration with all stakeholders. We will endeavor to break the barriers in human rights and issues related to stigma and discrimination. I strongly urge all of us to press on, particularly healthcare providers. Let us not relent because we can beat this disease. Yes, together we can end TB in Kenya. And I heard the governor say something here. Pimwa TB, tibiwa, ishi poa, and thank you. Sasa, that was the president's statement. As you know, I cannot edit it I cannot deduct, and I cannot add. So from now onwards, what I speak is mine. Yake imewekwa, si namna hiyo? But let me say kwamba pahali yuko, aliniambia nije hapa, niwahakikishie kwamba ingao yeye ni mkaaji wa hapa, anasimama kama kiongozi wa taifa, akisema kwamba tupambane na magonjwa zote, lakini leo tulenge sana yale amesema kuhusu ugonjwa wa tuberculosis. Nikitoka hapa pahali yuko, nitamwambia nimefikisha ujumbe, na watu wa Uasin Gishu walikuwa wamemngojea sana, lakini atakuja kwa sherehe nyingine. Governor Jonathan B. I almost used the other name, but I must be formal today. Governor Sang, CS Nakumicha, our partners, USAID, WHO, the members of parliament here, Muli and Omboko, who sits on the speakers panel, all the leaders who are here. Let me just point out a few things. One, as we were sitting there, I wish to point out that the government has taken up the issue of the community workers and how they can be motivated to continue doing their work. I think we have about 90,000 community workers across the country. And I think from April, the government is making the necessary arrangements through the budgetary process so that these workers can also draw a stipend that will support them. I do not want to pronounce a figure at this stage, but we are on track. I also wish to confirm that His Excellency the President has also instructed the CS for Health and the Ministry to start thinking about the Uasin Gishu facility that Governor Sang was talking about, since this county has made a contribution through the referral for the whole nation. They still need their share at county level, and I think the instructions have been given. So I think we shall be making some good progress. Sasa wakati tulikuwa tukikaa pale na nikasikiza PS akizungumza, yeye ni daktari, alafu nikasikiza CS alitaja kitu kuhusu Marburg fever. Unajua mimi si mtu wa medicine, mimi ni mtu wa hesabu. Sasa nikamuuliza dalili ya Marburg ni nini? Hiyo Marburg fever. Kwa sababu sasa saa zingine if we want to start at the family level, si hata familia, mwenye familia anaanza kuona kuna dalili ambayo si mzuri, si ndio? Sasa daktari amenieleza kwamba hiyo kitu inaitwa Marburg fever. Dalili inaanza kuonekana wakati mtu anaanza kuona katika kila shimo katika mwili yake damu inaanza kutoka, na unasikia baridi, unajisikia uko na hali ambayo sio ya kawaida. Akasema hiyo sasa, ukiona mtu ambaye yuko na mambo kama yale, basi labda hiyo kitu imefika, hiyo Marburg. Alafu nikamwambia dada yangu CS, juzi bila kutoboa siri za baraza la mawaziri, serikali imepitisha msimamo ama mswada ambao sasa lazima tulete Kiswahili, kwa sababu katiba inatambua lugha mbili, Kiingereza na Kiswahili. kama official languages. Sasa amri imetoka kwamba ni lazima sasa tuingize Kiswahili kwa mainstream sawa sawa, ili kila mtu tuelewane. Kwa hivyo itabidi kama serikali, na haya nitarudi kusema tena hata kwa kimombo ili partners wetu wafahamu na viongozi wafahamu. Nilikuwa nauliza, ukienda kwa hospitali na madaktari mko hapa, mnatupatia kile kitu kinaitwa prescription. Yani wanakuandikia dawa. Je, hii prescription inaweza kuwa kwa Kiswahili pia? Kwa sababu kuna wengine labda kuna shida, na ukitaka kutibu mtu lazima muelewane kwanza. Kweli ama uongo? Lazima tuelewane, sivyo? Kwa hivyo ikiwa tunataka tusaidie Wakenya wetu wakati tunafanya yale tunafanya, ni pia tena tujue kwamba, je, ukiandikia yule mgonjwa, wacha kumwandikia tu take 3 tablets 2 times per day. Muandikie pia meza tembe 3 mara 2 kwa siku. Ili watu waanze kuelewa. Na ningependa hata tuende zaidi kama taifa, na wadhamini wetu tukifanya kazi pamoja tutasaidiana. Tunaweza pia kuweka hiyo kwa lugha ya mama. Mimi kama Muluya nikienda niandikiwe vimira vaga hari kabiri kwidiko. Gavana, hebu njoo hapa uniambie kwa kilugha, hebu eleza hawa watu kwa kilugha meza tembe 3 mara 2 kwa siku.
Lowe kercheju somok konyil 2 eng betut amu koroitab ng'weny nekanamin.
All right. So let me now speak to this so that our friends from the World Health Program and the USAID and our other partners who are here can understand the gist of my message. I was saying that our constitution recognizes 2 official languages, English and Kiswahili. And recently, the government made a very firm decision that we now want to also mainstream Kiswahili into all our processes. And the medical field is particularly essential so that we can communicate with the people if we want to achieve universal health care. In Parliament, for instance, there are already standing orders that have been translated into Kiswahili, so they can engage and operate in Kiswahili. But I was just pointing out that when we go to most medical facilities, including into the deep villages in our communities, the prescription is still given out in English. The fastest road to curing people is to communicate fast. So the message we are saying that with the partnership that we have, We should now also have a program where you can support us fully in these campaigns so that medical prescriptions can go in Kiswahili and, if necessary, can go in our diverse mother tongues so that we can communicate easily with the people, particularly in the rural areas. And I gave the example of me speaking my mother tongue and Governor Jonathan B. speaking his mother tongue, and what we can do if, in the world of medicine, if we can actually make that something that we can pursue more aggressively than we may have done it before. It would be very helpful in making sure that we can fight and the various challenges that come with the lack of good health. So those were my remarks. I will not want to say any more. I think I've said enough. Tuchunge hiyo Marburg, tuchunge tuberculosis, pia tuzidi kuangalia hata cholera, kwa sababu wakati mgumu kama huu ambapo tumetoka kwa hali ya kiangazi, labda watu hawako wakitumia maji vile wanatakana watumie maji kwa sababu hayakuweko. Kwa hivyo haya magonjwa yote ni lazima tuyaangazie ili tusiwe na shida. But once again, thank you to all our partners for the support, for the encouragement. You've done us a good job. And I also want to thank Nakumicha and your team in the Ministry of Health, PS, for the good work you are doing to make sure that we are able to see the next day when we are in good health. God bless you all. Thank you so much for having us here. The two governors, asanteni sana. And when we finish, I have now a message to deliver to my boss, His Excellency the President. God bless you all and thank you.